Hi everyone, it's Dave Evans here from We Fix You. I'm a physiotherapist and we have facilities in Port Hope and Cobourg, Ontario. And today's topic is going to be about what do I do when I have a rotator cuff tear. There's a lot of people, they get pain, they get lots of movement, they got lots of limitation, they can't even get their arm up because of the pain. They go see their doctor and the doctor says, let's go get an MRI. The MRI comes back and you see that you have a partial thickness tear or a full thickness tear. What does that really mean? Honestly, a lot of us have partial thickness tears and full thickness tears. There's four muscles in the shoulder that make up the rotator cuff. And if one of those muscles, through wear and tear, through aging, through sports that you've done, repetitive movements have caused injury to that tissue, caused the muscle to break down and possibly have a small tear or a large tear in it. But the thing you got to remember is that most of us, 50% of the population, have partial tears or full thickness tears in their shoulder, in their rotator cuff. And so when you get the MRI back and it says, well, you have these tears, doctor says, one, he says live with it, or two, he says have surgery. A lot of things that you need to consider is MRIs are not the greatest mechanism to determine what the next step is for treatment. As physiotherapy, we deal with the pain. We deal with your function loss. We deal with getting you recovered, to getting back to the activities that you enjoy the most. So your options are physiotherapy. It's very conservative. We can talk about that. There's a surgery where you see a surgeon and you talk to them about getting it sewn up and then going to some type of treatment for recovery, or doing nothing and just living with the pain. Obviously, hopefully you don't choose do nothing, and sometimes the doctor will tell you there's nothing we can do about it, you're too old, there's too much problems going on, it's just not worth it, you're not able to do a surgery because of your health conditions. But I want you to be rest assured that with a conservative type program like physiotherapy, you're able to strengthen the other muscles. As I told you, there's four muscles in the rotator cuff. So if one is not working properly, there's three others there that are going to help compensate. And there's a lot of people out there, as I said, have these rotator cuff injuries that are living happy and healthy lives because they're supporting the shoulder with the other muscles. So consider that when you get a report back that you have a partial or full thickness tear in your rotator cuff. Surgery is an option, but I'm always on the cautious side of saying let's deal with it. Might take a couple months of rehabilitation, but let's see what happens. The other option is I don't recommend is doing nothing. There's cortisone shots to try and help the inflammation, but you're really not fixing the problem. You have a problem that is finally your brain is saying deal with it by sending all this pain to you, but you have to deal with the problem versus trying to mask it with medications or cortisone. So if you want to live with the pain off and on for the rest of your life, great, just do nothing. If you feel that you need to get surgery, I recommend conservative therapy at least for the first couple months to see if we can resolve the problems without having to go under the knife. So hopefully that answers a few of your questions about what do I do with a rotator cuff tear. If there's any other problems that you have, you can definitely check us out at wefixyou.com, or if you're in our area, call us in Cobourg or Port Hope, and we'd be happy to help you. Thanks so much.